Up okay? Thank you.
Jason, are we ready to call the meeting to order then, if everyone's ready, or?
Let's wait for Jeff's okay real quick.
Okay.
You are live.
Okay. Whenever you're ready, Dr. Amjad.
Okay, I'm ready. So, well, I guess what time is it? I don't even know. Well, good afternoon, everyone. We can call the meeting to order and ask for a roll call. Jason, if you're ready.
Okay. First up, Dr. Amjad, we know you're here.
Yep.
Dr. Joggenpally. I know he is here. We have Dwayne Bowles substituting for Colonel Cahill. State Police is here. Joe Deegan.
Here.
Dr. Kahn.
Here.
Dr. McMillian. Jesse Forbes.
I'm present, thanks.
Dr. Maleo. Dr. Barry.
Present.
Russell Williams.
Here.
Dr. Antolini.
Present.
Dr. Milton.
In attendance.
Joseph Hatton.
Present.
And Mr. Burnaby emailed me earlier, said he wouldn't be able to attend. So, Dr. Amjar, it looks like we do have a quorum and we can move forwards.
Okay, thanks, Jason. So, let me see. So we have to review the minutes from the last meeting from September 17th. Have the members reviewed the minutes and if there's any modifications needed.
Make a motion, move to approve the minutes from the last meeting.
And then we need a second.
Second.
So those that can be moved or approved. Okay. Any comments from, let's see, any discussion based on.
Next up would be any discussion based on comments provided from the public based on the last meeting.
Did we have any public comments?
We did, and they were sent to the members.
Are there any comments from that, guys? None.
Jesse Forbes, I'll just briefly comment that, I mean, we've received them and certainly I read through them and appreciate the public's interest in making sure that they get those to us so that we can take them into consideration and just to make sure anyone that sent those in knows that they were looked at, they were distributed to everyone and they're certainly have been reviewed and taken into consideration. So I just would thank the people that took the time to make those comments.
Okay, thank you. Okay, and the second item on the agenda is the medical cannabis patient certification form. Jason was going to do a presentation for this item. If you're ready, Jason, for that.
Yes, thank you, Dr. Amjad. We'll start with our old business items from the previous meeting. As Dr. Amjad mentioned, the first item is the patient certification form. This is the form that physicians will use to certify patients as having a serious medical condition. The board members were kind enough to give us feedback during the last meeting. On this form, we have added their suggestions, which are highlighted in blue. That form was also, the new version of that form was also emailed to you. I'd like to ask the members if they have any further feedback on this form. And if not, we will put this into use with our register of physicians.
This is Jesse. I have a concern in reviewing the final version of the form, and I think it just warrants some discussion. In the beginning, in the second section down there on the first page, there's a portion for the physician to discuss limitations or requirements, and it actually has, a blank for quantity, duration, and then the form of the medical cannabis. From a legal perspective, that still gives me some concern as to whether this is getting too close to prescribing certain forms and amounts of medical cannabis to be used. And is that going to cause, certainly there's doctors on here that can answer that better than me, but from a legal perspective, I could see it causing some concern to the physician as to whether they're getting up against the DEA problems with actually prescribing the specific forms. It was my understanding really the role of the physician would be to certify that the person has a condition that warrants the use and that it could be beneficial for them to have the use of medical cannabis. But when you get into actually saying how much they should get, what form they should use, how long they should use it, I'm concerned that the federal government could look at that and think that it's awfully close to prescribing something. And I don't want to throw a wrench into our program when we're this close to actually effectuating the legislature's intent. So I just throw that out for discussion. I'd be interested to hear the physician's thoughts on that.
Sure. Mr. Forbes, real quick before we start that discussion, let me explain why that section is on the form. Physician limitations is actually written into the Medical Cannabis Act, and that gives the certifying physician the option to make those limitations. And because that's in the act, we then transferred that language into the form itself. So the physician does have the option to let us know what those limitations may be, if any. But you're right. The ultimate decision, of course, unless there's, again, physician limitations on the form, quantity, or duration of medical cannabis is ultimately intended to be made at the dispensary. But
let me ask you this. In order to maybe, and I understand if it's in the code that the limitations are there, that it should be in the form. I'm just not sure that the way the code reads it meshes with the way this kind of almost looks like a prescription of you take this to a dispensary and the dispensary says, no, your physician said 10 quantity, we only sell it in 20s or whatever it might be. Is there a way to add some kind of disclaimer to that to make it clear that that these limitations are not prescriptions or something to that effect, or that the ultimate decision, as you said, is to be made at the dispensary by the patient, something like that?
I think we could definitely look at that. We could consult legal counsel surrounding a disclaimer, perhaps, as you mentioned. But I'd definitely be interested to hear what the physician members may have to say about that.
Well, I appreciate Mr. Forbes' concern because he's right. The differentiation between a recommendation and a prescription is important, certainly based upon DEA licensure. I don't think any recommending physician wants to be associated with prescription. Now, you did add that this is not intended to be used as a prescription under the blue. So I think that is useful. But I also get that sense that once you write this as a quantity or duration, that's sort of what happens in a prescription. You write for the compound, you write for the quantity, you write for how it's to be given, and you mark how long it should be. So there, I think legal counsel should look at that. We want to protect those that are recommending and not prescribing.
Any further comments from members?
Oh, I think I was muted. I was going to comment in the same line. I see that note at the bottom of the form. I think that would help with saying clearly that this is not a prescription. This is just a limitation or recommendation, but not a prescription. If we clarify this, I think it should work. People need to know that this is not a prescription.
Yeah, and it might even be that you could add something to the front of the requirement or limitation language at the top of that bold section that just says that, recommendations or something along those lines. But I think if you just ran that past DHHR's legal team and just make sure that they feel that that's enough. I mean, I understand the blue highlighted section certainly says it's not a prescription, but I just want to make sure that there's a comfort level for the physicians and that they're protected in what they're doing, and also that we don't throw into some, with the dispensaries where it looks like they think some kind of prescribed amounts. I just make sure.
Any further comments from members? Okay. So I'll take this as an action item moving forward. So we will consult with legal counsel about some sort of disclaimer based on the members' recommendations. We won't be able to wait till the next regularly scheduled board meeting to move this forward. So once we make those changes, I'll send out the form via email to members and see if there's any further comments at that time before making the form public.
Yeah, and I wanted to be clear, my suggestion wasn't to delay this in any way. I understand that it would roll out through DHHR, and really our advisory role will be informed of what's in the form, and we can make comments about it, but obviously we're not, DHHR makes final decision on that. So I just want to make sure that my comments aren't designed to suggest that we would need to wait till the next meeting.
No, absolutely. And that's what we were looking for on this, is just advisory comments. Okay, next action or next item. So there has been significant progress from the Office of Medical Cannabis since our last meeting in September. We have started to issue permits, and these facilities are being built out as we speak. So I wanted to make the members aware of the permits that have been issued. This is a list of our grower permits. There are 10, of course, we're limited to 10 by code. Next up, I have a map that shows their distribution across the state. Next up is the processor permits. Again, we were limited to 10 permits to issue for the state. And again, here's a map of their distribution across the state. And finally, I have a map of combined licenses and their distribution across the state. Again, this map signifies the grower and processor permits, 20 in total. Any questions from the members about the permits that we've issued? Okay. Next up, we're going to move on to a demonstration from our vendor Metric of our seed to sale system. I had mentioned this during the last meeting, but unfortunately we weren't able to complete the contract in time to provide this information in September. But we want to welcome David Eagleston from Metric to explain what this system is and what it's going to do for the Office of Medical Cannabis in the state of West Virginia.
Awesome. Thank you, Jason. And just for clarity check, can everybody hear me all right?
Yes, David.
Yep. Everything's good. All right. Awesome. First off, I do want to thank you, Jason, and the team for giving us the opportunity to come present on Metric for West Virginia. We're extremely excited to get the implementation of Metric up and running for the West Virginia program, and then walk through everyone here today just on a few key items of what Metric is and what we do for the cannabis supply chain within the regulated industries. Just a little background with me on the call today. I also have Louis Koski, who is our Chief Operating Officer, and Nick Figueroa, who is our Program Manager with West Virginia. And then speaking here, this is David Eagleston. I'm the Director of Program Management at Metric, and I've worked with Metric for a little over 3 years plus now. working on implementations and ongoing operations of all of our existing markets across the country for monitoring regulated cannabis. So really excited to have West Virginia be our 16th program at Metric that we're kicking off here. If you can go to the next slide, please, Jason. All right, we wanted to give a little background to you all of what track and trace or seed to sale is from an explanation standpoint. So Metric and what we do is essentially a compliance management solution. It's utilized by regulatory bodies across the United States for the oversight of the marijuana industry. So tracking everything from that initial input of those seeds or clones at the cultivation facility, and then all the steps along the way from the supply chain process, whether that be moving the products through plants to harvest, packaging those products, manufacturing those products, and then the last step in the process from our perspective is the distribution or sale to the patient or end user at the dispensary level. Metric is a cloud-hosted online software reporting tool, so it's something that ultimately requires no type of hardware or downloads or anything along those lines. Essentially, if you can connect to the internet, you're going to be able to access and utilize Metric. And then purposes or use cases behind what Metric has been for the cannabis industry is it helps regulating bodies identify with the data either inversion or diversion. I know a lot of folks focus on the diversion aspect, but just as much as diverting product is an aspect of these marketplaces, we also see opportunities for inversion, so infusing potentially black market products into the regulated market. We do this via data reporting and analytics based on what these businesses are reporting into the tool. So it gives the jurisdictions and regulatory bodies a line of sight to all the information that specific business has, whether it be plants, packages, or sales, depending on the business type. It also provides jurisdictions and some other use case purposes, a streamlined process for recall purposes. So say, for instance, there is an issue at the dispensary where a product does require a recall. Because we're all in a centralized database here and the tags that we utilize at Metric are uniquely serialized, it gives the opportunity for the regulatory authority to pinpoint any product along the supply chain process and potentially, if applicable, put that product on hold or conduct a recall if necessary. The other last thing that I'll say with Metric and purposes behind it is for tax collection purposes. So we have from our other jurisdictions that we work with, if tax is applicable, that they have the ability to review data and information to apply or put together those expected tax values from collection within the industry. You can go to the next slide, please, Jason. So this is just a little infographic of the information flow. So as I noted on the previous slide, Metric's designed to capture the entire ecosystem of the cannabis supply chain, and that really starts at the inception of seed. So as you'll see here along the way, this is essentially the happy path of what could happen for a seed or clone within the Metric system, where licensees are going to be tagging those initial plants with that unique identifier as the first stage of reporting back to the regulatory authority, specifically the number of plants they have and the counts on those plants. Through that time, they're going to be recording different aspects of what they're doing to those plants, whether that be trimming them, wasting them, or harvesting them into packages. Once that usable marijuana has been packaged and reported into Metric, they're going to be able to do and conduct multiple different aspects of whatever they need to do for their specific business. And what I mean by that is they're going to be packaging and sending samples to testing facilities. They're going to be packaging and sending product to manufacturing facilities for manufacturing processes. But ultimately, once those packages enter Metric, they're going all their different directions based on the supply chain and business needs. And then as you'll see here, as it gets to the final step in the process, once those products have gone through the required compliance panel testing and have passed all compliance panel testing, they could be transferred to those dispensaries and ultimately sold to the patients here. And from Metric's perspective, that sale and the quantity associated to that sale is the last step in the chain of custody, if you will, of the product within the licensed marketplace. You can go to the next slide, Jason. There's two types of tracking at Metric. So you heard me talk about uniquely identifying plants, and you've heard me talk about packages. Those are the two types of tracking that we do at Metric. Plant level tracking, which you see here, is done on a plant by plant basis, where the cultivation or grower facilities assign a unique plant identifier to each individual plant. As you'll see here, kind of in this screenshot of what it typically looks like for a cultivation user in Metric, there's different actions that they can do. So if you recall back, growers are going to be trimming, they're going to be recording additives, recording waste, potentially creating planting. So you're going to see all of those reportable actions are available for them to select and report back to the regulatory authority of what they're doing within their specific license. The other thing you'll see here within this screenshot is everything in Metric is logged with a complete event history. So if you want to look into what specifically happened to this plant, at any given point in time, you're able to actually drill down and get additional information that's stored for the regulatory authority to take action or just review information as they see fit or necessary. And then Jason, if you can go to the next slide here. The other view that we have is our package tracking. So any amount of marijuana that's either the raw marijuana or the infused products that may be sold, processed, or transferred is required to have a unique tag created in Metric. The tracking of these packages in Metric is intended to be lot level tracking. So sometimes there is a disconnect when we first get started within a market where folks are thinking they're going to have to tag with a Metric unique tag identifier each individual unit item. But the purposes of this is actually to capture the production batch information and the lot numbers and things along those lines. So instead of thinking Metric packaging requires each potential concentrated unit item, it would actually be that entire batch of what was created. And with this level of reporting and what you see here, once again, you're going to have those different actions that they're able to do, whether that be repackaging, submitting packages for testing, transferring those packages, and all of those events as well are stored in the historical dropdown of each of the individual packages. And then with this level of reporting, you're going to see 4 real main buckets of benefits, which I'll cover here in this next slide. So what do we see as the 4 key benefits of Metric and what Track and Trace provides to our agencies, that being transparency. So with this centralized database and all the reporting that's coming into this tool, all of that information is actually viewable and reportable by the regulatory agency in real time. So if there is a question that arises around a specific business and what they're specifically doing at any given point in time, the regulator is actually able to go in and view that information in real time. The safety of this and the benefit of the system having all of these packages to be required for testing purposes and transfer allows, once again, the agency to ensure that no product is getting to the end user without going through the proper testing components and getting there to the dispensary with that compliance testing and the results reported directly in Metric, viewable not only for the regulator, but for the dispensary as well prior to making a sale. The security standpoint, I know we had a law enforcement officer on the line here earlier. One of the other great things about the security aspects of Metric is it also provides transfer manifest reports. So if a licensed business is transferring from one location to another location, Metric actually gives them the ability to print out a transfer manifest, which covers all of the necessary information that's required to be entered in Metric for a specific transfer, and that being driver, vehicle, the number of packages, and then the destination facility, so that you can verify and validate, once again, if the product on the road is a regulated transfer or something that may need to be investigated further. And then lastly here, the last key benefit that we have is just the reporting that's available to both the regulators and the industry users of the system. With all of this information coming in real time, you can pull whether it be plant information, package information, or sales information directly out of the system and help inform any future policy making or decisions that may need to come about as it pertains to the industry and the direction you want to head with the industry based on what you're seeing from the reports that they're providing into Metric. So if you want to go to the next slide here, I do want to offer some time for questions. Like I said, this is David Eagleson here, and then also I have Louis Koski on the line, who's our Chief Operating Officer, and then Nick Figueroa, who's our Program Manager in West Virginia. And if there are no questions, I thank you all for the time and look forward to getting everything up and running here in West Virginia.
So just to comment, is this coming from this whole metric? I think this is really good that you have all those different metrics and reporting system. Is it coming from the government office, West Virginia state, or who is presenting? Is it coming from state?
So Dr. Khan, Metric is a vendor employed by the state and the Office of Medical Cannabis.
Okay.
And
my question is, how are you going to measure those, like quality control, THC content? Are there a lot of sites and available and certified by the state?
Yes. So the state, the Office of Medical Cannabis, and also the Office of Laboratory Services within DHHR will set the lab testing parameters that these products must meet. And again, as David mentioned, the products will be tested through commercial laboratories and also our own laboratory at the Office of Laboratory Services. And that data will then be reported from those labs and integrated into the tracking system.
Okay, thank you.
Thank you.
Mr. Eagleson, can I ask, how many different states are you folks operating in right now?
Yeah, so West Virginia will be our 15th state that we work with, along with the District of Columbia. So 16 in total.
You guys have already had to invent the wheel. We're just getting the benefit of it now.
That was the design of the tool. So we started in Colorado back in 2013. So that was the first program we worked with. And I think the beauty of what Metric provides is that with the system, it is something that we do leverage all of our updates and enhancements for all of our jurisdictions. So anything that's being requested from previous markets that they've identified as necessary to have in the system is something that we offer for all of our programs. So it is something that has been tried and true for the last 7-8 years.
Very good. Thank you.
Yep.
So, Mr. Eagleson, the presentations you gave, are these similar to the programs in Colorado, California, your other states? Is this very similar to those?
Yeah, so the intention of Metric is intended to allow the jurisdictions that we work with to have this base tool, but they can configure it based on whatever the regulations and requirements are within the specific jurisdiction. So as we go through the process of implementing with Jason and his team, we're reviewing all of the specific rules and requirements for West Virginia and ensuring that it's configured to make sure it matches what the expectations are for the West Virginia market. But at the same time, you know, the base system is what we utilize across all of our markets.
So are you working in collaboration with DEA and all these numbers and metrics? Are this also going into the DEA database? I mean,
no, we don't. Yeah, we don't share any of that information. So we treat the data, if you will, from Metric's perspective as that data is actually going to be Jason and his team in the state of West Virginia's data. So if there's any types of requests in that regard, we would process those through their office. But we don't work directly with any third parties in that regard.
so is there any like a central control mechanism for this whole all state? These are all going to some place or not?
So yeah, great question. So each instance of Metric, like, so for when we have West Virginia up and running, is unique for West Virginia. We don't cross over anyone's information or data in that regard.
Okay.
Dr. Khan, I can speak a little bit further to that. States have begun to form an association of cannabis regulators so we can share information amongst ourselves. That way, if perhaps a new state discovers a new way of doing things, a better way of doing cannabis regulation, each state can benefit from that. So there is cooperation going on there. Any further questions for Metric?
So this is Joe Hatton. I had a question about the analytics. How is that used in law enforcement? Can you explain that a little better?
Sure, yeah. So what I had met for the law enforcement component is certainly on the security aspect, and that being in Metric, when a user or a business conducts a transfer in the system, they can actually have a printable transfer manifest report. What the benefit there is from a law enforcement perspective is if you potentially come across a specific transport and it is a legal transport, they should have specific documentation and information that you guys can validate and verify. But obviously, if there's additional reporting and information that we want to pinpoint, we could pull data elements and share, obviously, once again, with Jason and team, number of transfers and things along those lines that could help kind of just framework how much product is moving across the state.
Yes, I was more interested in the side of folks adding maybe some local material into the batch that wasn't coming through the grow facility, as to how those analytics would pick up some of that.
Yeah, great question. So what we look at from that perspective is we first obviously have the starting point, have to start on collecting the data and information. But with that, we can start to pinpoint if there are anomalies or anything that sticks out in that regard, such as, to your point, a harvest of 10 plants yields just an egregious amount of product. Those are different flags and indicators that we can define in the system with the regulators to make sure that they have visibility on that. Whether, there's plenty of different data elements along the way that we can capture, whether package adjustments, potentially transfers that were reported, and then the package weights were changed on some, format of what they entered in. So there's plenty of notifications and elements of that we can certainly provide, and will provide Jason and his team to make sure that they're informed on all of those things. And then I don't know, Jason, I don't want to speak in terms of where if that's publicly available or whatnot, but.
Well, I guess I was getting to if somebody's putting some local material into the batch, how is that information going to be determined, and how does that get to law enforcement, and whether or not your analytics is actually going to work in court? Has it been proven elsewhere to work and proven to be upheld by the courts?
Yeah, metric data has been utilized. I don't know if, Lewis, you want to step in as kind of with your background, if you're able to give a little bit of thought and insight to this as well. Like I said, Lewis, go ahead, Lewis.
Yeah. So real quick, just a little bit more about me, so it kind of helps to understand my perspective on the question. Back in 2014, I was the director of the Colorado Marijuana Enforcement Division when we first legalized, and I spent my entirety of my career mostly in the law enforcement and regulatory side of things. When we were originally designing Metric, we did it with the intention of securing the data in such a way that it does become evidentiary. In fact, especially on the regulatory side of things, which is where we did most of our cases, we never had any issues with the data that we were pulling out of the system being used as evidence in a case. We also, kind of depending upon the jurisdiction, law enforcement has also used data that was in the system, or in a lot of cases, the lack of data in the system to frame their cases on the criminal justice side of things. So there is precedent for law enforcement to be able to use data that comes out of the system for various purposes. So it'll kind of depend upon how things are structured there in West Virginia. It's all over the map in terms of how all the other states do it. And so we'll be working very closely with Jason and his team to make sure we help them to the extent that they need it with using some of the data to be able to show compliance or non-compliance with regulations. But generally speaking, the tool was designed to be used for evidentiary procedures.
Joe, the Medical Cannabis Act does allow for law enforcement access into this system. So we will, as we roll this out, we'll work with various agencies in the state to make sure that they do have access.
Yeah, no, I was just trying to get at how do you in the system determine that maybe somebody's adding some other materials in there, and then based on the analytics, if that's all you got for evidence, are you actually going to be able to get a court of law to agree with you? So I'm good on the process. The other side of that whole issue is how much of those data points are going to be required under DHHR, because you give a lot of data points on a daily basis almost. That may be a challenge.
Sure. As Metric mentioned earlier, we are customizing their system to match the data points required by our act and our state. And that process does seem to be going well. I think we can make the system match up with those requirements again as we proceed through the rollout.
Thank you.
Thank you. Any further questions regarding Metric? Okay. We definitely thank the Metric folks for participating today, and OMC is excited to work with vendors like Metric. We can, as mentioned earlier, use their lessons learned from other states in the past to help our program go as smoothly as possible.
Thanks for having us, Jason. Thanks, everybody.
Thanks again. So real quick before we move on, I want to skip back to number 3 on the agenda. I want to make sure that the members are aware that we did roll out the forms for submission of new forms of medical cannabis and also new serious medical conditions on our website after they were adopted during the last meeting. We did not receive any valid submissions in the past quarter. There was one submission, but it appeared to be an individual trying to sign themselves up for medical cannabis. And of course, that wasn't the proper use for the form. I did reach out to that individual, but was not able to establish contact with them. So again, just letting the members know that those forms are out there and in use. Okay, moving on. So this is going to be a late addition to the agenda. Dr. Berry has submitted some possible recommendations for the board to consider. And I'm going to turn this over to Dr. Berry to explain each suggestion. Dr. Berry, do you want to start with your first suggestion?
Yeah, thank you, Jason. So I'll go ahead and just read the proposal. So the first one is require dispensed cannabis be added to the West Virginia Board of Pharmacy Controlled Substance Automated Prescription Program, the CSAP. Grounds for this being cannabis is a product that is an intoxicant with known health risks, particularly addiction. In a state whose citizens suffer from the highest rates of addiction in the nation, it should be of paramount importance that a mechanism is in place to both safeguard the population and monitor patient safety. Such a mechanism already exists in the CSAP. Although cannabis is not designated as a prescription medication, it is considered a medication according to the West Virginia Medical Cannabis Act, and exceptions could be made to add a non-prescribed medication to the database. Doing so would allow clinicians to make informed decisions regarding whether or not to co-prescribe controlled substances, consider drug-drug interactions, and screen for addiction and mental health risks. In addition, it would allow public health researchers, pharmacists, and regulators to collect real-time and longitudinal safety data in an existing accessible platform that has HIPAA-compliant privacy protections. This was mentioned at a previous meeting, and I've been able to contact Dr. Mike Goff of the Board of Pharmacy, and he believes that it is possible to do this. It would take some work and some creativity. Ohio does this currently, and it would just be a matter of figuring out how to particularly do this in the details and how it would show up in the actual registry that physicians are looking at. One possibility is what we do even now with overdoses. So if If an overdose occurred and I'm looking up a patient that I'm prescribing a controlled substances for instance, there's an asterisk that'll be on the form that the patient has had an overdose. And so that could be a parallel mechanism, just as a potential example for how this can be done.
Are there any comments from other members regarding Dr. Berry's first suggested recommendation? And again, I want to remind especially the newer members, the Medical Cannabis Board makes recommendations to the legislature for changes to the Medical Cannabis Act. It's not a unilateral action that the board itself takes. It's a recommendation to the legislature.
This is Jesse. I'd say one thought I had, and this kind of goes to all of the recommendations, and I appreciate Dr. Berry's time and looking into these. Without having more information about how Ohio does it, and I know I kind of keep going back to the same thing, I'm very concerned about us making recommendations that then get closer to prescribing or something that looks like prescriptions. What I'm wondering about with really all of the recommendations is, are these things that might make sense to study through one of the work groups and then have that work group make a presentation with possibly more information about how other states handle these issues at our next meeting before we take an action on whether to actually recommend to the legislature in some report that these things be addressed. I would just suggest that we might need a little more information, and it might be helpful for us to get that through one of the work groups moving forward, and then address these concerns and anything else that might come up through the work groups at the next regular meeting.
I agree with Jesse wholeheartedly on that. Anytime I hear statements like it can be done, it sounds to me like it's just the potential to put more hoops for patients to have to jump through and potentially delay the implementation of the program even further. We've already had patients waiting almost half a decade to access medicine that is, currently available for patients in more than 35 states across the country. And I think that, it's worth looking into, but I don't think that making a recommendation now is the way to go.
I guess my main concern is now that it's going to actually get off the ground is trying to get ahead of it before it does. So these are things that we can monitor as it goes forward before it's actually implemented would be my greatest concern.
Well, and one thing just to kind of walk through that thought, doctors, all we would end up doing is making a recommendation to the legislature, even if they took an action in this session. It's going to roll out prior to the effective date of any passage in all likelihood anyway. So, I mean, that's the one thing I'd just like to have a little more information to make sure we don't make a recommendation to the legislature that ultimately there's been problems with elsewhere. I'd just like to have a little more data. And I think if we had a bit more time for one of the work groups to take a deeper dive on this and give us, what did Ohio do? How did they do it? The same with the other recommendations. I just think we might be in a stronger position to really evaluate whether this is what we as a board want to recommend. Now, certainly there's nothing to, if someone else has an interest in this, there's nothing to prevent them, not necessarily from our board, but personally from going to the legislature and suggesting these types of changes, be looked at in this session. But from our board to take an action on it, I'd like to have more data personally, and I think a work group could kind of get that for us and make a deeper dive with a presentation, maybe even something submitted prior to the next meeting, so we can all kind of have a sense of exactly what this is going to mean from a legal perspective, not just for patients, certainly for patients, but for patients, for the doctors, and for the industry.
Personally, I think because I am a pharmacist, of course, so I feel like, yes, it should go through Board of Pharmacy, but at the same time, as you just mentioned, we need to find more data what other states are doing. Are they controlling it through Board of Pharmacy or something else? But I feel like it is well justified to go through Board of Pharmacy.
Any further comments on the first suggestion? Okay. Dr. Amjad, I'm going to put this back to you to ask for a motion either to make the recommendation to the legislature or to put this back to a work group for further study.
I'm hearing everyone's thoughts. I mean, I know we don't want to delay anything moving forward. So I think given the time frame, we do want it to be available to people in West Virginia. I do know Dr. Berry's concerns, and those would be mine too as a practicing physician as well. So I think we should let it move, put it back to the work groups though for now so that it can move forward. So the people in West Virginia can have some, use for it, and then put it back to the work groups so that they can dive into it more, and then we can move it forward and then let it go. So into more.
To the extent we need a motion to that effect, I'd move with respect to this recommendation, and I don't know whether it makes sense to move it with the others at this point or have the presentation first, but I'd make a motion certainly with this one and ultimately with all three of them that they be assigned to one of the work groups and we have more data and a further presentation at our next meeting.
Anyone second that?
I second.
Okay, and just before you vote, just to clarify, is this motion only for the first recommendation or all three?
I'll go ahead and make the motion as to all three. I mean, I think it might save some time.
Since you're going that route, do you want to toggle through these real quick so the public can see all three?
Oh yeah, absolutely. I wasn't thinking about it. We already had a submission on them, but absolutely, I think
Okay.
we should hear on all. Maybe it would make sense to hear on the other two and have those presented, and then I can make that motion.
Okay, sounds good. All right, Dr. Berry, will you explain your second suggested recommendation?
Yeah, I'll go quickly through these then. So the second one was require THC concentrations of any approved product be no greater than 10%. The grounds being higher concentrations of THC of the greatest health risks. Such risks include severe anxiety, psychosis, impaired cognition, and addiction. There exists no randomized, controlled, replicated studies of sufficient quality to demonstrate THC concentrations greater than 10% are beneficial for any indicated health condition. I'll get to the third one unless there's questions about this.
Yeah. Any questions or comments regarding the second suggested recommendation from Dr. Berry?
This is Joe Deegan. I definitely would support that. Would support this one now. I have a concern about the concentration being too high, and do we have a way of monitoring that right now? Before things.
I see.
Before things take off.
Only mention here is THC. How about CBD? CBD is a better option, better concentration and less side effects compared to THC. THC is the one that has more addiction type effects. So, but do we also need to make some comment in that line with CBD, or we just want to keep with the THC?
And I'd just say, I think that's why all of these, I think if we put these into a work group, we can get a streamlined suggestion that we make to the legislature that is supported, and we make sure that we're asking for the right things. I mean, if CBD makes more sense than THC, then you run into, again, we get back to this prescription idea. Is it something where we're recommending that that these percentages be set by a physician's recommendation, or are we saying that the legislature should cap it? And if that's the case, again, I think the more data we have through a work group, the better received this is likely going to be. And I understand the position of trying to get these things out before this thing rolls out. But again, if you send this to the legislature now, at best you get a bill this session. It's not likely to be effective, even if it went through prior to the implementation of the program. So, it's something that's going to have to be addressed after the program rolls out anyway at this point. So I'd rather have more information. And I think if we put this into a work group, we're going to have more details on all of these proposals. And we can really have one that makes the most sense for all of us before we vote on something today that, we received basically the recommendations this week. And I don't know that we've had a lot of time to look at what other states are doing.
Dr. Barry, are you okay with those suggestions? I mean, this is your new suggestions, and are you comfortable with putting this to a work group?
Yeah, I'm comfortable with that.
Yeah, I mean, I think that makes more sense. We don't want to push out something there that hasn't been vetted properly with this group, I think.
And again, for public benefit, Dr. Barry, do you want to explain the last suggestion?
Sure. Prohibit combustible forms of cannabis as an approved product. Smoking organic material cannot be considered a safe route of delivery. As such, there is no medication that has an FDA approval for smoking. Like smoking tobacco, smoking cannabis delivers harmful irritants and chemicals to the pulmonary and cardiovascular system, both to the user and those around them, i.e. secondhand smoke. Risks of smoking cannabis include tachycardia, stroke, cardiovascular disease, bronchitis, and chronic obstructive pulmonary disease. West Virginia suffers from these conditions at disproportionately high rates. To endorse smoking as a therapeutic modality would increase the incidence of cardiopulmonary conditions and exacerbate current problems.
Okay. From the OMC side, I do need to make a couple points about this. One, smoking is not a currently acceptable use of medical cannabis. However, once these products are sold, we don't have much control in that area. Second point is, especially again for the new members, the sale of the plant form of medical cannabis was included in the board's first report to the legislature. They recommended adding that form of medical cannabis to the legislature, which was done during the last session. Any comments from members regarding this last suggestion?
Yes, I think, yes, smoking, but there is another form very similar that is called inhales, that is kind of nebulization. That is a standard method of utilizing a lot of medications, not only cannabis. So I don't know if we can really recommend this the way it is, because it's not just smoking, as I am saying. And there are a lot of drugs that are standard process or mechanism to inhale. And that is I mean, very easy way and quick way to get into brain if we want to. So
yeah,
but
that's
for
why
that, you need some purity. For that, we need really good purity. The problem with smoking or inhalation, if the product is not pure enough, we'll get a lot of toxicant. But if we get the pure product, then this issue is not as much as we are thinking.
right. That's why I specifically said smoking as opposed to inhalation or other forms.
Well, and I think if we tweak some of the language with this, I mean, obviously none of us are going to advocate that people smoke things and have, you know, secondhand smoke situations and contribute to cardiovascular disease or others. But the way this reads, it's almost counterintuitive to what the legislature just did, because they did pass the dry leaf. And I mean, technically that can be a combustible form. Although certainly I think what we could do is if the work group looks at this, try to tweak the language so that we're making a recommendation that, that smoking not be an acceptable use, which I think already actually is in place. And I think that's something we could kind of look at this language and make sure the recommendation isn't something that is asking the legislature to undo what we just recommended a couple of years ago, because there was other reasons for the dry leaf other than obviously smoking. Which I think we probably made clear when we made that recommendation last time. But there again, I just think all this are things that if we have a little more time, we go through a work group and we actually kind of assess how best to phrase what your thoughts are here, that these things are good ideas, and we can try to get them, you know, kind of streamlined in a way where everybody maybe is in agreement with them, or at least we're more comfortable with sending it to the legislature.
Any further comments on the third suggestion? Okay, Dr. Amjad, I'm going to put this back to you to take action on the seconded motion to refer these suggestions to a work group.
No, I'd like a second motion to put them all together though, as one item, if that's okay.
I'll amend my motion and make the motion that all three of these proposals from Dr. Barry be sent to a work group for further study, evaluation, and a presentation to the board at the next meeting, and that we address those at that time.
Is there a second?
I second, like before.
Okay. You want to take a vote on that, Dr. Amjad?
Okay.
How are we voting, Jason? Are we raising hands on the click thing, or are we just going to say aye, or how are we?
So I cannot see everyone at once, only 3 members at a time. So I would recommend that you just take a verbal vote.
Oh, gotcha. Just go around to everybody.
All right, so those in favor, if they want to go around and say yes or aye or however you prefer, please.
Maybe text yes. That would be easy.
Okay.
I'm going to make another recommendation.
chat.
Let's just take a yes or no vote. I think we can handle that just verbally here, just en masse. Yes on this motion.
Yes.
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 Are there any no's? All right, Dr. Amjad, I apologize. I think that motion carries.
Okay, great. So let's see. Are we on item 6 now, Jason, then? Let's see.
Yes, we're finishing up. We're coming up on our allotted time for the meeting.
Okay.
Again, action items for the next meeting. We're going to take into consideration more adjustments on the patient certification form. We're going to move Dr. Berry's suggested recommendations to a work group. The Office of Medical Cannabis will facilitate the process, and we'll bring that back up at the next MCAB meeting. Let's see. The next meeting, if we continue on with our typical third Thursday every quarter, and I apologize, I should have had this before. It looks like that will be March 18th. Is everyone agreeable to March 18th at noon to 1 again?
Yes.
Yes.
Any no's? All right. For the next meeting, do members want any specific topics of discussion beyond what we've already discussed as action items?
Yeah, I would like to send to one of the work groups. I think we need to discuss the potential to recommend patient home grow. Especially here with the situation with COVID, even if the dispensaries were open and the program was implemented and everything was up and running right now, patients are going to have to come out of pocket because insurance doesn't cover their medication. And now that we're in a global pandemic, even if this program was up and running, a lot of patients will be left out in the cold. I think this is something this board definitely needs to look at.
Okay. Dr. Amjad, for consistency, I would recommend that you ask for a motion to send Rusty's recommendation to a work group for consideration and then vote.
Okay. Is there a motion to send that to a work group for the home growth?
I'll make the recommendation.
Okay, is there a second for that, please?
I make a second.
Okay. Everyone that's a yes, please say so.
Yes.
Yeah.
Yes.
Yes.
Any no's on that recommendation? All right. I believe that carries, Dr. Amjad. Any
Question.
further topics from the members for the next meeting?
I just have a question. Our work groups, now we should have obviously now we should have a work group meeting.
Yes,
Are
Joe,
you going to assist us in setting those up, or do we set those up amongst ourselves?
So OMC will facilitate that process. At a previous meeting, the work groups were established. There just hasn't been a topic for them to consider until this point. Now that we do have topics, we will facilitate those meetings. Unfortunately, due to the pandemic situation, that they will have to be virtual.
Okay.
Any further topics? Okay, moving on. So as usual, we'll accept public comments by email. I would ask the public to submit those to the email address listed, medcanwv@wv.gov, and please put in the comment line MCAB public comment. And again, as we did this meeting, those will be shared with the members. Okay, Dr. Amjad, that's all I have for this meeting.
Okay, we just need a motion to adjourn the meeting, guys, in a second.
So
So
moved.
moved.
All right,
Second.
thank you, everyone. Have a good day.
Thank you.
Thank you.
Thanks.
Bye,
Thanks,
everybody.
Jason.
Thank
Thank
you.
you. Bye.